Hold on, I need all the pre-workout for this video. Welcome back, friends, for a Trying to Conceive Thursday evening update, and I'm so excited to be back. Before we get started, I just want to give you guys like the biggest thank you and like virtual hug that I can for all of your outpour of love and support, and to all of those that subscribed, all of those that liked this video, all of those that reached out to me. You have no idea how much that means to me, because I was so nervous to even open up at all about what we were going through, but normalizing the conversation of pregnancy loss and infertility, endometriosis, PCOS, just all of these things that get pushed under the rug is so important for me to bring light to. And I could not be more thankful that opening up did give me that reassurance that I needed to keep going. So without further ado, let's get into the update. So on November 5th, Thursday, I had my like 1 week, 1 day after my methotrexate injection, doctor's visit update kind of thing. So when I went into my appointment, my HCG levels were still existent in my body. My levels were at 54 and we were expecting them to be at 0, but that's okay. Everybody's body works a little bit differently. Some people take a little bit longer to have their HCGs drop completely to 0, so it's totally okay. They are a lot lower than my highest HCG level blood test, so that's good. It's heading in the direction that we want. And probably in another week or so, my levels will be back down to 0. So with that being said, I am going back in for surgery on November 30th. It's a Monday. So I kind of want to backtrack a little bit and give you guys like a backstory of how this ectopic pregnancy kind of happened in the first place. So in April of 2019, I was diagnosed with stage 3 endometriosis. And what's difficult about endometriosis is it has to be diagnosed typically through surgery. There isn't tests that you can run to see if it's apparent. Every woman is very different. You could be stage 4 with no symptoms. You could be stage 1 and you're dying every month with your period. It's just so case by case. So I went in for a laparoscopic procedure back in April of 2019 and had my endometriosis diagnosed. When I got done with surgery and was in my recovery period, at that time, we weren't ready to start trying to have a baby. So we basically needed to, 1, prevent pregnancy, and 2, stop the endometriosis from forming more. My option at the time was to go on a Lupron injection, and it was awful. I did that injection one time. It was a 3-month dosage, and what it does is put your body into menopause to prevent any further endometriosis from forming. You do not cycle, you do not have a period, it just stops those functions. When I tell you the side effects from this medication could have put me in a freaking, I don't even know, it was awful, okay? So I decided to stop that treatment. I felt that for me personally, I didn't want it. Dealing with my cycle every month and dealing with the possibility that endo was going to form was a less risk for me than having to deal with the side effects from Lupron. Just for me personally. I'm not saying that's the route at all to take if you were in that predicament, but for me, that was the best option. So I treated my endo in the most holistic way possible. I was taking supplements to kind of help prevent the pain from my cycle every month. I was having acupuncture done to kind of increase flow throughout my body so that all of that wasn't sitting in my uterus kind of thing. There was just different things that I was doing that helped my pain subside kind of every month and didn't make my period as long every month. But little did I know that endo was still forming throughout this. I mean, I didn't think that it was 100% taken care of, but what angers me is I feel like if I just would have stuck out the Lupron, that my ectopic could have been 100% prevented, because from what it sounds like, there's endo forming back inside and there's blockages in my tubes kind of thing. So that's the unfortunate part, but going in for surgery will take care of that. So my doctor is going to go back in for a laparoscopic procedure, clear out my tubes, remove one if one needs to be removed, clear out any endometriosis that may have formed or scarred in that time frame, and just prep my uterus for trying to conceive again. And the great news from this appointment is I can start I guess I need my husband, we can start trying to conceive again right away. And that is fantastic news. I thought that it was going to be at least 3 to 6 months before we could start trying again. And when you're trying to conceive, like 3 months doesn't sound like a long time, but it's excruciating when you are trying to conceive. That's 3 months of just sitting around waiting. So I was very thankful that that is not the route that we have to take. Once we get done with surgery and my first cycle starts, we can start trying again. So here within about a month. So I'm very, very happy. I was so ecstatic with that news. So I'm about 2 weeks out from surgery, and right now there's really nothing for me to do other than every week I have to go in and have one blood draw done just to make sure that my HCG is still dropping, and it has to be at 0 by the time I go in for my procedure, and it should be down to 0, no problem by then. But I'm kind of sitting tight right now. I was very thankful that they got me in for surgery like within 3 weeks, right after Thanksgiving, to like get the ball rolling, because like I'm a fast moving person. I don't want to sit around and wait any longer. So one question I did get that I wanted to address is, what symptoms did I have when I found out I had an ectopic pregnancy? And the answer is none. I had no symptoms other than the fact that I didn't stop bleeding. I thought I had a period, it kind of stopped for a couple days, and then I started bleeding again. I was not in pain, nothing was cramping, nothing hurt. Just there were no symptoms present other than consistent bleeding. I've read online there can be symptoms from, cramping, back pain. Some women get a very weird like pain in their shoulder. I think that's kind of like when you're at your worst case, like you're at the worst part of your ectopic, and bleeding is very common. But I had no symptoms with my ectopic pregnancy other than the consistent amount of bleeding. And why that information is not helpful is because it's not uncommon to spot or bleed a little bit, especially in your first trimester of pregnancy. So that's why if you are concerned at all, stay persistent on your doctor's office, ask questions, just monitor it. If you know something's not right in your body, like you just know. So that is where we are with this week's update. I am just kind of a sitting duck until I go into surgery. Especially with everything going on in the world. I have to have a COVID test done. I have to quarantine, all of those things. So we're just kind of sitting around waiting for surgery, but it will come quick. So counting down days until we can get this cleared out in here and we can start trying again. And you guys, I promise I will get better at operating YouTube. I can go off on like such small tangents when I get talking. So I'm kind of like a squirrel and all over the place. It's fine. Everything's fine. But I just wanted to reiterate too, I am absolutely here to offer any support that I possibly can if you are in the same predicament as well. I'm popping my social medias up here. If you want to connect, slide in my DMs. I am absolutely here to chat or scream with you about how life sucks with infertility. I have for you guys this week. I love you all. Thank you so much again for all of the support that we've received, and I could not be more thankful for those that have made the decision to follow along our journey with us. Bye, friends.